Right, it is now 6 p.m. Thanks to Councillor Kondarka's device, I can confirm it is 6 p.m. So we'll make a start. Can I welcome everyone to this evening's Housing, Environment and Health Overview and Scrutiny Committee. The first item on the agenda is announcements and the evacuation procedure. A fire drill is not expected, so if the alarm sounds, please evacuate the building quickly and calmly. Please use the stairs and do not use the lifts. Once out of the building, please gather outside Lloyd's Bank on the opposite side of the road. Exit by the door by which you enter the room or by the fire exits, which are clearly indicated by the standard green fire exit signs. If you need any assistance in evacuating the building, please make yourself known to a member of staff. Please also make sure all your mobile phones are set to silent. The meeting will be live streamed. Will not today be live streamed to YouTube, but will be recorded and put onto the council's YouTube page for future broadcast. I could also ask that all mobile phones are set to silent or turned off. Item number 2, to receive apologies for absence. I've received apologies from Councillor Scott Harbison. Are there any other apologies to report? No? Okay. If that can be recorded, please. Item number 3 is to confirm the minutes of the meeting that was held on the 1st of February. I've gone through those minutes and I believe them to be a true and accurate record. So I propose those. Do they receive a seconder? That's seconded by Councillor Shires. Does any member wish to speak? No. In which case, I'll put it to a vote. All those in favour, please show. Against? Yeah, okay, that's unanimous. Thank you. Cheers. They just be passed down. Thank you. Item number 4 is to receive declarations of interest. Are there any declarations that members would like to declare? No? Okay. Item number 5 is public consultation. I've been notified that Mr. Smith wishes to speak on item number 7 about the George Eliot Hospital. Is that correct, Mr. Smith? And that's the only item? That's the only item? Yep. Okay, brilliant. So, item number 6 is questions to Cabinet. We've got Councillor Gutteridge with us this evening, who's Cabinet Member for Health and Environment. Councillor Golby is running late. She will be attending the meeting. So what I propose we do is we put our questions, if any, to Councillor Gutteridge. And if Councillor Golby is still not here, then we basically delay her part for any other business. Is everyone content with that? Yeah. So are there any questions to Councillor Gutteridge? Councillor Kondarka.
Always showing up when he can. It's very useful to have the Cabinet member here. First question I wanted to ask was about the trees, because obviously every year we have a winter tree planting season, and we've lost a lot in Bedworth with the War Memorial Park and the Miners Welfare Park, having the bits taken down for where the leisure centre might be. Can we have an update on how good your tree planting was this year, and if we're also looking at the trees on the adopted sites, because obviously we're about to take them over, and it's useful to make sure that they are both in good health and we can plant some more on these sites which will get adopted. Thank you, Chair.
Councillor Core, I welcome your question. We'll start with the physical activity hub at Bedworth. Yes, we did remove trees, but we are planting over I think the last count was there'll be 140 trees planted in place of the 30 trees we took down. This year, I think we have planted 232, I think, if I was correct. So we planted over 600 trees in the last few years.
Councillor Gutteridge, Councillor Kondarka.
To come back on your answer last night about the balancing ponds on the new estates, I totally understand that the water safety policy doesn't require us to have fencing added around the ponds, but I wasn't quite sure whether it prohibited there being any fencing. So if you could just clarify, because you kept waving the document saying water policy, but You're doing it again, yeah. I get it that it's not a requirement, but is it a prohibition, or is there something we could actually have a look at doing some planting or something just to ease the residents' concerns? Because I'm not expecting a bulletproof fence and laser guards around all these ponds, because they're ponds. But I think just on the corner nearest the climbing frame, it would be nice if we did allow the residents to have a bit of hedging or kick rail. Thank you.
Councillor Kondaka, do you want me to read my answer to your question last night? Well, I'll read it again. The adoption of public open space on the 3 developments at the top of Weddington Road are progressing, but are at different stages. The furthest along is the Davidson Churchfield site. The fencing was removed about the SUDS, Sustainable Urban Drainage System feature, as it was not on the approved plans. I repeat it again, not on the approved plans. And contrary to council adopted water safety policy. The council is currently preparing for the adoption of this site, which should be completed later this year. Parks adopt it first, then it goes on to legal. And it should be noted that the balancing feature is no closer to the play facilities than they are to the river anchor itself, and that our water safety policy will be applied in determining the future management arrangements of this site. And I believe also you've spoken to officers about this and you've put a member inquiry in. So hopefully you will understand that when we adopt it, we will look at it. It's not ours at the moment. So when we adopt it, we will evaluate it. I hope this puts the question to bed once and for all. Thank you.
I see no members indicating, so what we'll do is we'll take the Councillor Golby part to any other business. Councillor, you're more than welcome to stay, but you may have other
I have another appointment.
That's fine. Thank you very much for attending, and as Chair, thank you for coming for the last 2 years and always taking questions. Thank you.
Can I just say that the water policy...
As always, thank you. So we'll move now to the next item. We have a report from the George Eliot Hospital to give us a general update on their activities, and I'd like to welcome to the meeting their Director of Strategy, Service Improvement and Partnerships. Jenny, can you hear us okay?
I can, yes, thank you. Can you hear me all right?
Yes, we absolutely can. Thank you very much for coming along this evening. We've all got your report as an appendix, and I'm sure that we've all taken a comprehensive look at the content. Is there any key headlines that you want us to be aware of specifically, Jenny?
Yeah, I thought, if you wouldn't mind, just a couple of headlines, probably over and above the report, just because they're sort of like currency things in addition to that you may be of interest to members. So I just wanted to draw attention to the fact that we do have 2 new wards that have been developed on the site, and we are hoping that they will be actually opened from on Saturday. So that's obviously additional information that we weren't able to include in the report. So that's about sort of obviously supporting us with our offer to the community. And also, I omitted from the report to add in the quality section that since we last updated you, we've had 2 CQC inspections, one for our ED, which we received a good, and one for maternity, which we also received as a good, and also for our ITU, which was also good. We've very recently had a unannounced CQC visit of outpatients, which is just a normal sort of part of their routine to do unannounced. We await the outcome of that, but we've had positive feedback so far. So I just thought it would be useful to add those 2 points because I thought they would be of interest to you over and above the information that's in the report. Obviously, the report indicates the level of activity if for the hospital has continued to increase. It outlines where we are on some of our key performance metrics, which are good in comparison to the requirements and local benchmark, and we are continued to see a lot of activity, and I'm happy to take any questions, and if I can't answer your questions directly today, I'll be happy to take them away and come back to you on them, but hopefully those highlights will be of interest to you. Thank you.
Jenny, thank you very much. I thought it would be useful, and I don't know if you're aware, but we've also got Health Watch in the room for the item after yourself. I'm going to pose the same question, but I wondered if you could tell us from your perspective, how is the operation of the new Community Diagnostic Centre at the moment?
Yes.
Is it going to plan? Is it doing the job that it's meant to be doing? And have there been any stumbling blocks?
Yeah, so yeah, we're very, very, very proud of the Community Diagnostic Centre. I think it'd be interesting to see, well, obviously, any feedback from, and we keep feedback from our service users, but certainly in terms of our performance, we've seen an improvement in our diagnostic capability and our diagnostic rates, and we're on around 96%. So and aiming to move towards that 99%. We've had a new MRI facility and a new CTC scan. So we've got 3 stages for the programme. Stage 1 is complete. Stage 2 has just been the additional pathways for that are in train, and it will support us with our cancer diagnostic routes as well, which is obviously a key priority. So I think that it's actually been a real asset, and we're seeing the benefits of some of those earlier diagnostic pathways, which we're pleased to be able to offer on site.
That's good to know. Thank you for that. Thank you for that update. Any members wish to come in? Councillor Shires.
Hi, thank you for this, Jenny. It's really good. I am concerned about one part of it, and I'm sure you are and everybody else is, and it concerns me really because I'm sort of experiencing it at the minute, George Eliot Hospital, as my mum's in there and was admitted on Saturday and spent the first 3 days in the emergency department on the wing there. It's now back up to another ward where we've got 7 beds. In fact, 1 in the middle of the room because they've got nowhere else to put them. And we've got nurses running around, healthcare workers running around, and doctors as well, busy. I'm not saying they're not busy, but from what I'm experiencing from being in there is that patient care is wonderful when they're there, if you can get hold of somebody, but unless you have a relative who's willing to go and speak up for you, nobody comes. My mum's bedridden as well, so she's like, we're having to wait an hour, 2 hours to be changed, things like that, and people don't come to the thing. And it's not because they don't care, and it's not because they're not doing their job, don't get me wrong. It is the fact that, they're overworked, etc. And we know a lot of that. You ring 111 and they just tell you to go straight to the emergency room because you can't get a GP appointment, which I know Health Watch, and it's kind of the first thing that anybody says to you, which is putting that on yourselves. So how are we've got a paragraph in here about the 24-25 financial year, and there being no further additional funding, but you're going to be expected, to have more demands on you and to be having more efficiencies. So as you want to excel at patient care, I can already see at the minute, from this time to when my mum was in hospital previously, the drop in patient care, there's no other way I can put it, and I'm not saying that this is by any means the nurse's fault. So what really concerns me is moving forward, how that's going to affect, and particularly I'm aware that due to the social care system, we have vulnerable residents being discharged without a proper care plan in place. And I dealt with one resident where they went into overcrowding, and where we actually have people who are clinically well and can be discharged, but we have no care package or funding or anywhere to put them so they can be discharged. So I suppose my question is, are you as reading this and as me thinking, oh my God, and are you as a trust panicking that actually with the state of the NHS at the moment, even with the early diagnostic unit, etc., it's not going to be particularly helpful? I can reel off so many things at the minute that I've had to get involved with, of patients who've been diagnosed with cancer and the poor diagnosis and how long that's happening, and I've had to get involved in a few things. So I was pleased this was on today, because it really is quite a concern of mine. Thank you.
Well, there's quite a lot there, so I'll try and take it in stages, and if I miss something that you feel that I haven't answered, then I'll happily try and come back to it. So let me take it in chunks. So it is absolutely imperative to ensure that we give the best care that we possibly can, and I'm glad that you recognise that the nursing and the staff are working really, really hard to deliver that care, because we do genuinely have a really committed workforce that are absolutely delivering or trying to deliver the best care that they can. It is true that during the periods of winter, which it feels like winter has gone on for an extended period of time, that we have had significant increases in terms of the number of people that we're caring for, and it is certainly true that we are seeing iller patients, and the acuity of care is quite high coming in through our doors. However, so clearly, if anybody is not receiving the care or the communication that they feel that they deserve, then we would absolutely say we would want to know about it, and we would want to liaise with those families and friends of families in that situation. However, we have been in a situation where we have had to add additional beds into wards, but what we have always ensured that we have done in that scenario is to ensure that we are safely staffed, and I can give you that we have been safely staffed to those requirements. Clearly, when people are very busy, sometimes the opportunity to interact with staff with loved ones may not be what we would like it to be, and if that is the case, then we would absolutely want to hear from that and look into that. But certainly we have had safe staffing levels, and and as our last CQC results have indicated that we are providing safe care. In terms of the point that you make around the financial position, it is extremely challenging. We haven't finalised the settlement this as yet. That's will be done in early May, but there are conversations with regard to the financial submission at the end in that period. We do feel that there are improvements that we can make in terms of our productivity, and we can deliver sort of increased care in terms as well. In terms of some of the financial issues that you've raised, we have had in the past quite a high temporary staffing level, which sometimes comes at a premium cost, but we're really pleased that we've made improvements in that area so that we're getting staff that are permanent staff, and that means that actually we can take down that staffing bill, and also we've been addressing things like our staff sickness, etc. So we are confident that we can deliver safe care. It is a challenging environment, and it is important to acknowledge that in the way that you've described. And as I say, we strive to provide that safe care and are open to feedback if people feel that we've fallen short of that, and we always look into those considerations. In terms of the CDC, and also you mentioned about wait times, we don't want any of our patients to wait. We want to treat them as soon as we possibly can do. However, nationally, there are waiting lists. We do benchmark well with those waiting lists in terms of where we are. But as I say, we want to deliver those appointments and those operations quicker, because we don't want people waiting and we don't want people suffering while they wait. And we're doing everything we can to bring those wait times down. So I think I've covered most of the points that you've raised. I would say it's challenging, but I do believe that some of the significant advances that we've made, for example, as I say, some of the new wards, etc., will address some of those issues that you've raised in terms of the having additional beds on ward areas. But I do want to stress that we have maintained safe staffing levels.
Brilliant.
So I think that's important to say.
Thank you, Jenny. And I have to admit, I've made an absolute mistake on my part. Mr. Smith, you were down to speak, and I should have let you first. I do apologise, but you've got the floor.
I think this corporation and all the corporations that come here use the same template. No information here that's relevant to the service. The reason more hospitalisations, is it because of the rollout of the COVID-19 jab? How many vaccine injured people do we have in the borough? That's something a lot of people would like to know, yeah? Overprescription of pharmaceutical products, another reason why probably that this could be up. None of that information there, yeah? Diagnostics, why is there such a massive increase in cancer? Why are more people dying than ever before? You're a health service. You should be investigating this. You know what I mean? All corporations seem to run for the benefit of the executives and directors in them. This isn't of any use to the people I've spoken to about the services in this borough and across the country. That's answers we need to know. Hospice care. I'd like to know about the protocols NG 163 and NG 191, which is basically the Liverpool pathway rolled out again across the NHS, which was stopped for the very reason it was cruel and killing people. Yeah? No mention of that. You mentioned none of the protocols you use, how much pharmaceutical products costing more. Is that the midazolam? And the morphine that was used over the past 4 years in the care homes, people are sent home with it. Yeah? Life-ending drug. You just send people home with that and expect carers to give it them. None of that's in here. This is just, like I say, the same template every corporation uses in here. Yeah? A few figures, no real information. There's a lot of people I've spoken to are suffering because of the national health. Yeah? Because of the national health. Failed this country miserably. Yeah? And a lot of people are really, really getting fed up with it. It's about time you started acting as a health service. There's far better products out there than all the pharma. You're just a pharmaceutical outlet. And that's from a personal experience I had there when that was all I was offered. Morphine. Yeah? No treatment, no nothing. That's personal. Yeah? That's all you do. Offer pharmaceutical products. And you look at the list of side effects from all those and the big piece of paper you get with them, yeah? And on every one, death is a possible outcome. And that's all you're dishing out. You've failed on the health side completely, yeah? All you do is dish out pharma. And it's about time it was put right. Thank you very much for your time.
Sure to come to you for future medical advice, given your professional knowledge on the matter and your degree, I'm sure, in medical science. Councillor Kandaka, you have a question to Jenny.
A couple of Councillor Shire's experience because my mother's gone through that about 2 months earlier, not in the borough. And one of the things we really need is more capacity. That we have 10% more people in the borough. If you look at the more 85, 80-year-olds, that age group is more or less doubling. So how are we getting more funding to double the frailty and the hospice care and the palliative care and all the things we need for an older population? Because we are actually hopefully living longer, but that means more of us are actually in that frail section of the need. And I say we have developments, and they keep saying, well, Section 106 money's for NHS and George Eliot and whatever, but are we actually able to upscale our frailty and those assessments that the frail people need?
Do you want me to come? Sorry,
yes,
I don't know
please,
the
yes.
protocol. Do you want me to come back in now?
Yes, please. Yes.
Yeah,
Just take the points of
perfect.
Councillor
Okay, lovely.
Kandaka. Just
thank you both. I'll go backwards then. So in terms of frailty, Councillor Condor, frailty is absolutely one of our priorities, and I think you're absolutely correct that frailty is a kind of a multidisciplinary kind of response, because obviously individuals often have a multitude of different needs. So we are actually focusing on that, and we've been working closely with some of the PCNs to develop some frailty assessments so that we can support people. So actually they don't come into hospital and they can be dealt with at home, because we do know that people can decompensate when they come into hospital quite quickly. So obviously, if it's safe and appropriate for people to be supported at home with the right care and with the right wraparound support, then actually that's sometimes the best place for them. So our frailty work is absolutely a focus for us, and we are developing that multidisciplinary planning and care, both in terms of the acute end of the pathway when people are in the hospital, and also to live with the conditions or particular issues that they have at home. In terms of the expansion of services, as I've already indicated, we've got 2 new wards which are opening on Saturday, so that does increase some of our capacity. But we've also introduced, like other places in the country, the virtual wards where people are supported once they've gone home, but are supported by the consultant and the care that's given whilst they're still linked to the hospital, and that's been able to expand some of our provision also. The other thing that we've been doing is working with something called ambulatory care, which is sometimes people need an intervention, but they don't need to stay overnight. But that means that we can actually bring them into hospital, support them with an intervention, but not necessarily keep them overnight. So I think all those package of things are important. In terms of the finance, I mean, obviously, we'd love to have more funding. I'm sure we understand the pressures on the public purse at the moment, and obviously we're in conversations with regard to the financial submission. That's not something I can really comment on, but obviously in terms of doing the best that we can with the funding that we do have, I do feel that we've been very prudent in terms of some of our investments, and they are targeted with in terms of thinking about how we can best use the site. For example, the community diagnostics, as we've already discussed, the additional wards, etc. We are aware of the additional housing challenge and the demand. And as I said, it is it is a challenging environment. But and to the first point, the first speaker, I do feel that it's important that I say that our staff are very professional, they work very hard, they deliver good services within the protocols of good clinical care. The comments in relation to the pharmaceuticals, etc., would not be appropriate for me to respond to, but I can assure everybody in the room that the service is working within these requirements.
Jenny, you don't need to respond to that. We just have to go through the process of letting him say what he needs to say. But thank you. Councillor Cape, yes.
I'll try to hold it together. Okay, I don't often agree with Mr. Smith, in fact, almost never. However, I kind of got one question that I was working on that you might be able to help with, which is when we talk about care, in my experience recently, the process is fantastic. And the metrics for the systems and standardization and throughput of patients, I couldn't fault. However, it's a question of feedback on a personal level. How good is the trust, and how could we improve that kind of human personal feedback? Not by exception, i.e., if you've got a complaint or you feel that something's not gone well, which is what we normally ask, okay, complain if you're not happy. I would much rather see a measurement of empathy and the old care.
So obviously, I totally agree with you that that care is not just about the physical needs of a patient. It's the holistic care, and that includes the communication with families as well. I think that's really important. Feedback is really important, and we do encourage feedback. We have a process where people can feedback through PALs that people will probably be aware of. We have the friends and family feedback. We're also encouraging all of our wards to invite feedback on an ongoing basis, which I think is what the gentleman was referring to in terms of how can people give that feedback. We do have the patient forum, which works with us as well, and they go out onto the wards and they do they give us feedback in terms of what they see, and they do kind of like visits, etc., on particular areas, and look at how cleanly the wards are, etc. And so we take that feedback as well. We also have had situations where the provision hasn't been what we would have liked it to be, and there's been complaints perhaps, and we work with families that are in that situation. We apologise and we try and learn from those situations if they do arise, and we also have some of those stories or that feedback come through to our board, because our board takes it very seriously. So I suppose what I'm trying to convey is that we are want to deliver excellent care. If we ever fall short of that, we want to have the feedback, we want to look into it and make sure we do something better next time. But at the end of the day, we are, the standard of care for us, and that is not just about the quality of the clinical care, that's about the empathy with which the care is giving is very important, and I would agree with the speaker that is an important part of the care.
Thank you, Jenny. I'm going to take one final remark from Councillor Kandaka on this item, and then I'd like to move on because I know Jenny has another commitment in a few minutes. So, Councillor Kandaka.
Yeah, just town centre board and transforming Nuneaton, because one way to free up space is actually to do more of the outpatient stuff in the town centres in Nuneaton and Bedworth. And it's really hard with the politics and the bureaucracy of the NHS to spend money off your site in the town centre. But have we got any way of progressing more use in town centres for either yourself or one of your partners to provide facilities, which would then in turn either free up space on your site or potentially stop people having to go to Coventry, to Walsgrave for various tests and treatments?
Yeah, so we are engaged in those conversations through the town centre and other partnerships, and also we have an estates forum which is with a range of partners, and we're actually having a particular focus on conversations and discussions around the Bedworth Health Centre site. So just to assure people, we are engaged in those conversations, and that's probably what I can say at this stage.
Thank you. I think we would all share the view that having those sort of services on people's doorsteps in town centres is a good thing, not just for the NHS but also for the local economy as well. So, so that's great. Jenny, thank you very much for your attendance this evening, and as always, thank you for answering to the best of your ability. And we will. I won't be the chairman of the committee for much longer, but obviously, I'm sure my successor will continue engagement with you over the next few months. Thank you very much.
Thank you very much.
See you
Thank
soon.
you.
So we now go to our next item, item 8. We've got Chris Bain from Health Watch. I hope you're doing well, Chris. It's great to have you with us. Obviously, we've seen both the colour and the black and white version of your report. So if there's any key headlines that you want to point out to us specifically, please do. But I'm sure we've got quite a few questions on the intel that's coming through to you from Health Watch.
The discussion that arises from the presentation. What I've done, Chair, very simply, is to, on the second slide, set out the statutory duties of Health Watch Warwickshire, what we're obliged to do, because I find I'm still having to explain that to people 10 years on. The thing about Health Watch is that we don't give opinions. What we do is say, this is what the evidence says, this is what people tell us, this is what residents tell us. And we will then convey that information and try to persuade both providers and commissioners that it's important to take notice of it. So when I looked at these data sheets have come from our quarterly performance report. We have to produce one every 3 months for the County Council about what's happening. And if you look, unsurprisingly, GPs, hospitals and adult social care come out top of people's concerns. But I think what is interesting is that pharmacy is rising rapidly up the agenda as a cause for concern, as is dentistry. And there are places in Warwickshire with no NHS dental provision. Luckily, Nuneaton is not one of them yet, but it may be coming your way. And mental health services are another challenge. And what I did on this slide was to include what we call a funnel chart about what are the key themes within GPs and hospitals and adult social care. And unsurprisingly, quality of service is right up there. But so is communications, is right up there, all over the place. And I do have to say, picking up on what we talked about a couple of minutes ago, where there are delays in accessing either diagnostics or treatment, communications becomes ever more important. Otherwise, people become anxious, and they begin their journey anxious. So I hope that the diagrams that you put there are reasonably helpful. I put in something specifically about GPs because I kind of guessed it would come up, because it always does. And unsurprisingly, booking appointments and communications comes out top of the challenges that people are having. And I'm not surprised about that. But if you look at it, you also notice that medication is beginning to rise up the agenda. We hardly saw it when I first started. It's there all the time now, along with pharmacy. I think it's worth saying, and also looking at hospitals, it's worth saying that people don't come to Health Watch if things are going well. They will come to us if there's a challenge, and they've usually tried about half a dozen other people before they ever come to us. So when the people are talking about hospitals, a lot of the really good experiences of hospitals won't appear in this. And I think it's fair to say that. But you will look, and I think there will be no surprise that the quality of provision communications comes out. But other things come out as well, like transport and parking, which is becoming a real difficulty for people. And given the absence of home visits from general practice, which we used to get years ago, the issue about transport and parking becomes ever more important. And waiting times and accessibility, no surprise to see them there either. And they're consistent now. They spiked occasionally, but they are consistent now. As part of our quarterly performance report, we are refining it to focus on the 3 places in Warwickshire: South Warwickshire, Warwickshire North and Rugby, so that we can talk to the people locally there about what's happening. And we've tried to include in there some of the things that people's views in North Warwickshire North are generally more negative than the other two parts of the county. Not quite sure why that is, and it may well be something to do with communication, I have to say, because the focus on communication at university hospitals in Coventry and South Warwickshire Foundation Trust, I think, is more intense than it is. I was going to say that to Jenny if she'd stayed on, because I think there is a real issue about communication from the George Eliot and about the way they do that. A couple of last quick points. We're doing a Veterans Health Check project in the north of the county. We focused on the north because you've got the barracks here, you've got the Gurkha community, you've got other people. So that is running now to the end of May. And if people can urge veterans that they know to complete the survey, it'll give us a more complete picture about what's actually happening to veterans in the north. And we can use that to talk about whether it's affecting the veterans elsewhere in the county as well. So the final slide I put on, Chair, is probably, ironically, the most important, which is the special mentions. These are the emerging priorities. These are the ones that we see more and more and more. And we ignore statistical blips over a year, but these have been coming up consistently now for some time. And no surprises amongst any of them: pharmacy, communications, transport, quality of treatment, the impact of delays. The NHS, can I just complain about the NHS for a minute? They are very good at recording delays. They are less good at telling us what the impact of those delays are, how it affects the experience and outcomes of patients. They're not quite as good at that. And technology, there are people who are digitally excluded from trying to get on to healthcare systems, and I think that's a real challenge. And adult social care has been starved of funding for some time now, and I think they are struggling. We did talk about discharge there briefly. Discharge is a system problem. It's not just a problem for the hospital, it's a system problem, and we all have a part to play in that, right across the system. And I've been banging that message for quite some time now. And the final bit for me, Chair, and then I'll take any questions, is we are seeing increasingly the impact. The Royal College of GPs is talking now about the impact of the cost of living, and that is beginning to affect the conditions that people are presenting with. It's also beginning to affect in terms of pharmacy, because people can't afford all the pharmacy that they're being prescribed, so they are choosing the ones that they buy. They are essentially self-diagnosing, and I think that's going to be an emerging problem as we go forward. So I'm happy to take any questions or to have any discussion on any of those points, Chair.
If we haven't already done so, I will ensure that Abu, as our officer who deals with the Armed Forces Covenant, takes away that survey from Health Watch and shares on our social media channels to try and boost engagement. If I can start, 2 points. I know that you work on evidence and data, but anecdotally, from intelligence coming through to you, I just wondered if you could tell us how you think GPs and primary care are sort of adapting to the new NHS app, and if that's going down well from your experience. And the other point I wanted to make as well is, I don't know if it's something that Health Watch might be looking at more nationally rather than locally, but as the NHS starts to use artificial intelligence more in its communication efforts, are Health Watch going to be doing any work basically on making sure that's obviously done right, so that people are receiving the correct information? It's basically not some robot deciding when people are going to be put on a waiting list or whatever. You know what I'm trying to say.
Yeah, we are doing a bit of work on AI. The primary objectives of AI are to reduce waiting times and to make appropriate referrals. Those are the primary reasons for doing it. And we'll be making a judgment about whether that's more effective than what's there now. Because I think there is something about somebody knowing a patient and actually understanding where part of it's anxiety and part of it is actual physical condition that can be treated. And I think AI will, I think it will adapt to recognise those things. but I don't think it's there yet. But Health Watch England are doing a bit of work now to see nationally how the impact of that is working out. And I think in terms of the NHS app, there is a report on Health Watch England's website now about the effectiveness of the NHS app from a patient perspective. And there are more people saying that it's a useful tool, that it's helpful, that it's clear, that it enables them to access things that they couldn't previously access. There are more people saying that than saying the opposite. And this, bearing in mind, is people contact us when they don't contact us when it's going well. So even amongst where it's not going well, the NHS app does seem, touching wood very carefully, to be doing reasonably well. The difficulty is there is a whole swathe of the population that does not have access to smartphones. And so the NHS app, if that turns out to be the only way of access, I think that will exclude significant numbers of the population, and we would be very concerned about that.
Brilliant. Was he, Councillor Cape?
I'm particularly pleased to find that there are now measurements appearing in reports about veterans, because I've been kind of pushing that issue on all the committees I'm on, including at the county, for a couple of years now. So it's great that we're actually starting to see the measurement being done, because if you don't measure, you don't know what you've got. So that's fantastic. Long may it continue. And I also believe that there's been a project launched in the north of the county on veterans' mental health as well, which again is a very positive step forward. So I appreciate it.
To add on those points.
No, just to say that one without dealing with the other, I think, is a mistake, and one we hope to avoid.
Thanks for this. I think it's more of a statement, really, rather than anything. And I think I've kind of gone through all this, and it's scary, the whole thing. And with regard to the patient access app, yeah, that's great for me. It's fantastic. It's the easiest thing I've ever done. But for my mum and some of her friends, it is they cannot. Haven't got smartphones. They can't log on. There's all these various issues, and there's a mountain of paperwork to complete to get her onto my app. So that's, I think the issues with that really is the people that are going to be excluded are going to be the most vulnerable, actually, who we need to ensure are taking their medication, are accessing services, and are finding that easy. I'm not surprised. The rest of it, I just find it all scary, and I think it just goes in line with generally what's happening with with what's going on with funding with the George Eliot, the cost of living, etc. And yeah, it's just a really scary thing that feels sometimes that I don't know, that we've not moved forward at all in any way. So yeah, carry on with what you're doing, because it is good. And why is the North not as happy? I have found, and I'm sure others can say this, particularly on social media, people are more happy to complain than they are to celebrate any little wins that you have, no matter how small they are. And I think sometimes that's just the way we are.
Thank you for your comments and your views. Is there anything you wanted to add to that, Chris?
Yeah, just very quickly. I'm in it now for 20 years. And when I look back at how it was 20 years ago, it is significantly better than it was back then. So we sometimes feel as though we're not making progress and that things are not changing for the better. There are things happening now I couldn't have imagined 20 years ago. So I think those things are working well. And in terms of why are people not telling us the good news, part of the problem is that men never talk to us. It's only women. And I don't understand why. Men won't talk about their health. So men in particular never talk about ill health. And they won't talk to us about it. And it's really hard for us to make a case for services when we have half the population that doesn't actually come and speak with us. So if there's any men that you know, please encourage them to talk to their GP, to talk to their health professional, and if they don't want to do that, to come and talk to us. That would be great.
Fine.
It's because it picks up things like transport that become more of an issue, particularly as we've got less bus services after COVID, and it's not just the patients, it's the visitors. Yeah, if we have a bus, we used to have a bus from Wellington 1 and 2s used to run through to the hospital. They now have to change in the town centre. If people end up going to Walsgrave, as it used to be, you've then got a major hurdle for a lot of people to visit. So it'd be useful to have a bit of a breakdown in terms of which transport issues and what sort of things can we do to help, I think it's mostly county, to lobby to actually get things working for people on the transport. The other thing that I really picked up on your comments was about people under-medicating because they can't afford it. I didn't know whether there was actually data on that, or was it, you know, do GPs know they're prescribed, say, 1,000 prescriptions, and then they've only had 850 actually cashed in at the pharmacy? Is that sort of stats available, and are you tracking it?
It's purely anecdotal. It's what people are telling us. What we have done is to ask the local pharmaceutical committee whether there is precisely the sort of evidence you're indicating. Is there a difference between the medications being purchased and those being prescribed? Because if we can establish that there is that gap, then we know how serious the situation is. On an individual basis, it's always serious. And those are the cases that we have to try and deal with. But what more widely, whether there's a huge gap between the two, I think if we can get that information, then we'd be very happy to share it, because I think it really matters.
Are there any other members who'd like to make any contributions on this item? Councillor Cooper.
The problem is, an awful lot of GPs are only doing a 3-day week. You know, that definitely, you know, is a major problem.
Chris, what's your intelligence about working patterns of GPs locally? Is what Councillor Cooper said necessarily the case?
There is a real challenge in recruitment and retention of GPs. A real challenge. And the people that are being recruited now are unwilling to become full-time partners. They would rather have a more flexible work-life balance, because the demands on a full-time GP partner are enormous. And they sort of do a sort of quid pro quo, what am I going to get for this? And a lot of them are unwilling to do that. And increasingly, you're quite right, what we are seeing is part-time and locum GPs. Now, we don't know the exact numbers because it's quite hard to get them. But we don't know the exact numbers, but what we are aware is that there was a time when you registered with a GP, you now register with a practice. And I think that has made it more difficult to track who's doing full-time and who isn't. That's made it more difficult.
Maybe they're getting a bit too much money, so they can afford to do a 3-day week.
Well, I think the GPs would probably argue with you there, to be honest. I mean, I think they're reasonably well paid, but they don't always agree with me either. But what I think what really matters is what are the number of GP hours available to people, rather than is it 5 part-time GPs or 3 full-time GPs. I think what really matters is what are the GP hours available and what is the expertise of those GPs? What's the quality of what they're doing?
Absolutely, yeah. Any other points you wanted to make, Councillor Cooper? No. I understand what you're saying, and I share your frustration, I really do. And, you know, I remember, you know, I mean, it's still the case to some extent with Bedworth Health Centre, but I remember in the day, you know, you virtually had your family doctor, you know, I would always go to Dr. Gustow's or Dr. Clamp, and, you know, it doesn't work in the same way now. And, you know, the relationship that you were able to build with your GP was a personal one, wasn't it? You know, and they knew you best. Councillor Kandaka, one more point, and then we're going to move on to the next item.
I know a lot of people who worked in the NHS you want to give up at a certain point because of the workload. So if we actually insist all doctors work 5-day weeks, we will actually lose 20 or 30% of the workforce, particularly the older, more experienced end of the workforce. or people who are actually raising children then going back to work but only going back part-time. So I don't think we should demonise people working part-time. I think it's a very valuable part of the workforce and a part we can't afford to lose.
Part-time, and at the end of the day, if they weren't needed, they wouldn't be called upon. And yes. Anyway, Chris, thank you very much for coming along. And I know my successor, whoever that is, will continue the engagement with Health Watch and the Borough Council. Thank you very much, and keep up the great work.
Great, I've enjoyed the session. Thank you.
Thank you. So we'll now go to our next item on the agenda, item 9, which is basically about the Council's Armed Forces Covenant. We've got Abu, who deals with this area for the Council. Abu, is there anything that you'd like to bring forward to the committee other than obviously what you've already presented to us in your report?
Briefly, I mean, the report is there. It kind of covers the work and the background with regards to the covenant. I guess the kind of key reason we brought forward the report is just to see if there's any kind of comments, any feedback with regards to work that we should be maybe looking at, a bit of a steer. Councillor Cape has been heavily involved in the work that we've done. He's been massively supportive, helped create many connections in terms of his connections and some of the wider work that's taking place. We've got some data in there with regards to the kind of numbers of veterans that we have in the borough. And just one additional point, just for clarification, there was the data in there doesn't kind of put that into context in terms of a Warwickshire figure, but the numbers that you have in terms of, based on the census, about 4,442 people via the census were classed as veterans living in Nuneaton and Bedworth. That makes, or that represents about 4.10 of the population. That's kind of second in the whole of Warwickshire, just behind Stratford. But again, the caveat with regards to that, when you look at the data, is they're the people that have declared themselves as veterans when they completed the census. Then as you look at the report, you look at the kind of key features of the employment recognition scheme. We are then working to complete our application around kind of August, September time. The kind of benefit and the premium service that we had when we previously applied was we had some funding, we had an officer that was dedicated to this work solely for 2 years. We had an additional amount of funding that we could invest in a huge array of projects at that time. That was great. Obviously that kind of came to an end. For us now, the key is kind of embedding the most important aspects of the covenant within daily service provision. And that is kind of manifest across kind of HR in the way we support veterans through our recruitment processes. So we just need to make sure that that is bolstered and is as good as it can be, and particularly around kind of the way we support people that maybe present as homeless or need support with housing or other services. They're the kind of key bits that we will need to be picking up within the application process. Obviously, the support towards events and other activities in partnership with lots of other agencies. Chris mentioned some bits there. There's other bits that are doing in and around health, recruitment. We're still doing a lot of that. So the kind of partnership work, the kind of connectivity with lots of other organisations to make sure that the services provided to veterans are holistic and well coordinated and well connected is something that is also a really, really important part of our work, even with the kind of more limited, say, capacity that we have compared to where we were when we previously got the Gold Award. It's not something that is lost upon us corporately, but it's a really important aspiration for us to do the best job that we can for our veterans. So the details kind of in there. Happy to take any kind of...
I'm sorry to put you in an awkward position, Councillor Kate, but I sort of want to throw this over to you because you're the veteran in the room. You've done your bit for our country, and thank you for that. But I suppose you've already have more exposure to this than us, and I'd be interested to know what your thoughts are. What more can we do, if anything, as a council?
As Councillor Shire has mentioned, I have noticed that the people of Nuneaton and the north of the county do tend to be quite forthright and negative on occasion. So I'm going to start with some celebrations. MBBC and North Warks Council are both rated very highly by veteran organisations, including the Veterans Contact Point, particularly in the area housing. It's a pity that Councillor Goby isn't here to hear it, but I'm sure you can pass it on to her, because they say that they do get a very sympathetic hearing, and I believe that as of at least a month ago, there were no rough sleepers, ex-military, in the area, which is a fantastic step. The Veterans Contact Point, who Abu has worked with in the past, have just received, I was lucky to be there for the presentation of a King Charles Award for a charity, one of only, I think, 8 in the whole of the county. So it was quite prestigious that they got that. So you've got organisations like that who are doing sterling effort. The north of the county was the first to have the Armed Forces Covenant signed up to, and the Gold Award, which was given. And the south of the county is kind of picking up a bit. But of course, I would say that because it's county-led, they tend to dominate the discussion rather, and I would like to see a little bit more input from this council. I'm just glad that we were able to get it on as a work stream, so that in future, whoever is sitting here or on the next panel, that should continue. And I would ask the officers to kind of try to ensure that it does, without having to have an advocate pushing it, which I've basically been doing for 2 years, probably to the much to the chagrin of others who are fed up of hearing about it, perhaps. So we're doing pretty good. I think it all comes down at the end to resources. And so the feeling that a lot of veterans have got is that, yeah, it's great if you want them to turn up and parade for a freedom parade. It's great if you want them to be there for flags raised for Army Day, Veterans National Services Day. But as far as actual real kind of recognition of benefits for those that don't need emergency help, it is still sadly lacking. The veterans don't think that they're recognised or valued, indeed, on the whole in the county. And I'm not sure what can be done to promote that, because you mentioned that you don't have the officer resources to kind of advise and assist on wider schemes. And it's that kind of thing that perhaps increases the profile a little bit more. So what can we do for them rather than them doing for us?
Contributions, and you say what is it we can do for them. We need to know about that, and it's all about engagement, isn't it? And I'm sure that we have good engagement with all local organisations, charities such as the Veterans Contact Point, etc. But Abu, have we ever brought the veterans community into the town hall for an afternoon for lunch or tea and coffee, just to hear what their general views are about the council? Just on a, I know we don't really sort of take certain sections of the community and invite them in, but I think it'd be useful to know what they think about us.
Modes of engagement, as Councillor Caper said, he's kind of had significant contact, particularly with the VCP, and there's other organisations. We've had kind of multi-agency meetings here where that focus of that conversation is often around maybe some of our services, but it's much more broad. It's not limited, but it's more for those that are living, particularly in the borough, about maybe health-related kind of support or services, and an array of other things. And for us, the key is we're quite visible, we're there, we're kind of coordinating those conversations, we're coordinating those meetings, is to try to join those up. So there's nothing wrong with that kind of conversation, but I think what would happen in and around that is it's a kind of, the focus would be on a number of things. And I think the point that Councillor Kate made is really, really important, and the challenge there for us and for other partners is to say the parades and those kinds of activities are almost some of the easy activities to kind of support. The key for us is the sustainable kind of premium service that we should be providing veterans, which is at the core offer of the Covenant is, and particularly, she's not here today, but the work that Jane Grant's team has done with the VCP and with other organisations to ensure around homelessness in particular, but some of her other areas, is fantastic. And that's something that we just need to kind of continually ensure is there at that level, or we can build upon. But yeah, the challenge there around post-COVID as well, and as Councillor Kate will well know, when we're talking to, there's a lot of peer-on-peer work, so it's veterans engaging veterans, because that tends to work better in most environments. It's still not easy. It's a community sometimes that isn't one that is the easiest to engage. But we need to make sure that we have the right routes to kind of unlock and solve that puzzle.
So, do you think there are, areas within this that need to change, or is there anything, sort of specific stuff that we need to be doing better? I open the floor to members on this. I mean, my view is, let's not change something that works well, but is there anything specifically that we need to do better or do completely different? Because I think now's the opportunity to sort of raise it at this, level and try and get those problems ironed out, if any. Are there any members who want to speak on this? Councillor Kandaka.
A lot of the things are actually county things. When you look at adult social care, all the things, and if you look at how many of the veterans are now over 80, it almost feels like you need the county's veterans people here as well, because it's a lot of things will be across the boundaries. The housing we can do well, but a lot of the other services are actually not us; it's county.
Discussions take place, don't they, Abu? Already, so.
Yes,
Yeah.
and again, as Councillor Caperson within the county that kind of have this as their primary remit, for us it's always making sure that we are trying to get the best deal for our veterans, and we're working with all of those providers. And I guess another point that is important to flag up is where people generally, if they've not worked or engaged with the veteran community, have this notion that it's generally very, very much more older residents. But if you look at the figures, 65% of our veterans are between 36 and 79, and we're seeing a lot more younger veterans with particular challenges, and there's a multitude of agencies working on that, but others are just, when they come in and they walk through the front door of the town hall, how do we make sure that they are recognised and they are valued in a way in which they are deserving? And that's a simple thing, but it's, I think, a very profound thing that we're doing okay, but maybe we need to do better.
More suggestions from the floor? Okay. I mean, my view is, let's not change something if it works well. I mean, and of course, we have the Armed Forces champion in Councillor Cape, and I think it's good that mechanism is there so that members can feed through to Colin as the member who, looks at this area in the council, and if things do over time change and we need to adapt, then we need to do that. But go on, Councillor Shires. Yes.
So is this mainly about when veterans are accessing us at the town hall? Is it from with what Abu was saying? Because my thoughts then would it be useful to have specific days, specific times that are open for veterans to come in, and we have a veteran volunteer who's there to support them, somebody who's potentially already gone through the support and advice that they've needed, and to guide them through that. And maybe to do that, if it's the partner that's coming in, to have the other partner there, if it's a family, so that they know that they can come at a time that there is going to be somebody there who's lived it, gone through, come out the other side. Because sometimes it can be just that. And even if, let's say, somebody comes in and they don't need to actually access anything, it may just mean that coming in and there's somebody there that gets it, because that can sometimes mean more than anything. So whether that's, and failing that, actually asking veterans, what do they want us to do? What can we do to make things better, so they feel that they are able to come to the town hall and be recognised? Because I think, again, for Nuneaton and Bedworth, we really, really do love and recognise our veterans. You know, and it's awful to think that anyone would think we don't. But so it's what can we do on that, and is there something that we need to work with? I don't know, citizens advice or somewhere where they put an hour aside a month. I'm just thinking so that there is something specific and tailored. Get the Royal British Legion in, you know, all those kind of things. Something where it's specifically tailored, and then there could be something then around working with some of the social housing landlords, albeit Midland Heart, who will have bits of money funding for community projects. And they will have veterans who will be living in their properties, so they may want to support access that way. Does that, it's just some ideas.
Some ideas, which Abu, I'm sure you take those away. And is there anything you want to add to that?
Yeah, no, I think, you know, it's a valid point. I think from our stations I've learned, is particularly to kind of to take those suggestions and take them through. We've got the VCP, we've got the Royal British Legion, we've got SAFA, we've got the kind of Gurkha Veterans. So working through those partners is to kind of maybe test some of those ideas out and then let them engage with the cohorts that they're engaging with, and then they essentially kind of filter that or work that and then come back to us, so we ensure that there's no duplication of those services. And oftentimes it doesn't feel like, it feels like, you know, a good idea that a council officer's got that is then it's an imposition on that community. So for us, you know, some of those ideas, some of those suggestions, or any of those ideas or suggestions, what we will be looking to do is we'll take those, we'll work through the contacts that we have, and then see where they land.
I think we've had a good discussion about this, and my message to members is, if you feel that this isn't going as well as it should, or things progress and we are not adapting, then we need to feed that back through to Abu and Councillor Cape as our member champion on this. Is that okay with everyone? Everyone content with that? Okay, in which case I'm going to move on to the... Abu, thank you for coming along, and thank you for your report, and I wish you all the best. I probably won't see you for some time, so it's good to... Thank you. We'll go on to our next item on the agenda, item number 10, which is the integrated performance report for the third quarter of 23-24. As always, we have Steve Gore here. Steve, obviously the members have gone through the report and the data presented. Is there anything specific that you want to make sure that we've absolutely understood?
Yeah, there are a couple of points. One is on the strategic risk register, which is the updates that have happened within the remit of the panel. And the other thing is just a brief comment on the complaints. If I could add those, because they're not strictly
please do. Yes,
fully
go ahead.
completed in the report. Yeah, okay. So as regards Appendix B, the key changes that have happened within the remit of the panel this time are: one, accommodation needs. A mitigation has been added regarding a tenancy support officer for HRA stock, and a planned action has been added relating to the creation of a homelessness prevention team. And R5, crime and disorder, a mitigation has been added regarding a full-time community safety officer role. In relation to complaints, I just want to go through the summary and then explain why there's a differential between last year and this. The summary shows that this is on page 30 of the agenda in the table. So as regards to complaints, the summary shows that 1,270 were received, 1,267 were completed, and 142 were late or outside the 10-day response time. 3 were outstanding. And the comparison, which I've showed this time, both on FOIs and complaints, shows that there's a significant increase. There were 770 complaints last year, 1,270 this. And I followed this up and established that it's mainly linked to the reconfiguration of the refuse collection rounds in relation to commingled recycling. So those are the only additional comments I wanted to add, Chair.
Steve, thank you very much. Any members have any points that would like to raise on this item? Councillor Kandaka.
I pre-warned the officers about one of my comments, which was about the figures in the middle of the tables because particularly on page 39 we've got £4 million worth of cash or profit in the third quarter, and that's supposed to evaporate by the end of the year. And the officers have actually come back to me to explain that actually the accounting system is not bringing in all the interest rate payments and all those things to the end of till we actually sign off the accounts effectively and have the end of the year. But what I would like and what I kept asking for was the housing HRA stuff was done very similar to the general fund, because on the general fund you can see on page 31 all the figures, and then all these sort of things like interest rates are all on the bit at the bottom. So it sort of separates out the regular pay your interest. So I don't know if Steve can take that forward for the next panel.
To be fair to Steve, I think Liam, the head of finance here, has already given you a very comprehensive, breakdown of why that is, Councillor. And I'm not too sure Steve would have anything additional to add to that. Liam clearly answered the question. I think you even accepted that from the email exchange I saw. So I think we need to leave it at that, if that's okay.
If I may?
Briefly, yes.
I was trying to get for the next lot can scrutinise, which is why I thought actually doing the HRA budget the same as the housing budget, like the general fund, actually means officers and members can see what's going on with the various streams. Just having a big number that's £4 million isn't actually useful to us because we don't know how the rents are going or so I was taking a suggestion. I totally take on board the things in a mess and they're going to tidy it up when they get the financial system better. But I think it's just worth, as a new administration will come in all the time.
To be taken on board. Any other members on this item? Councillor Cape.
Correctly. One of the exceptions that you raised, Steve, was the fact that there was a lot of complaints initially about the commingled refuse, which I personally think is fantastic and a great way ahead. Do you anticipate, therefore, that peak is going to disappear over time as people get used to the new systems?
Steve, I expect the answer is yes, but yeah.
Well, it is yes, and I agree that the commingle system is far better. We've got a similar situation that we had when the wheelie bins came in for the first time. There was a lot of dissension about that, and now everybody loves them. So yeah, I did speak to John Chiratt, and he explained that we did get a lot of gripes with introduction. I think mainly it was people concerned that their days were changing. I think.
Yeah, that's useful to know. One more, Councillor Kandaka.
Questions, Councillor Golby, later, but I'll raise the table. So shall I raise it now and it can be done whenever?
Well, maybe you can reference what the question is likely to be, so that Councillor Golby can have a look at the appropriate information.
Yeah, it's a bit on page 35 about Eaton House and how we're so far behind on the income, and quite often in these things it mentions, same with the voids, holidays and various excuses, but it'd be useful to know what's particularly causing the problem at Eaton House, which should be quite long established. Thank you.
Okay, we'll leave that until AOB. Okay, in which case, Steve, thank you very much for the report as always, and on behalf of the committee, thank you for your efforts this year, and I wish you all the best. For my obviously, I know you're not leaving, but I am, so
Yeah, well, all the best, Chair. Thank you.
Thank you very much. Cheers. Moving on to the next item is item 11, which is the forward plan attached on page 88. This is for noting. Any comments on the forward plan? No. Okay, we'll move on to item 12, which is the work programme attached on page 96. Obviously, not much use to myself and Councillor Shires, but are there any... well, not much use to you either, because you've only got 2 weeks left as well. But go on, you can make a comment on the... No, okay. Any other comments? No, okay, fine. In which case, item 13, any other items? We have saved the best till last. As agreed, we're moving the questions to Councillor Golby to this part. So, yes, we've got Councillor Golby here, the Deputy Leader of the Council and Cabinet Member for Housing. Are there any questions for Councillor Golby? Councillor Kandaka.
Yeah, the first, what is going different with Eton House, which is why we're so far out of track on our budget. Thank you, Chair.
Councillor Kandaka.
On page 40, it talks about longer times to get the voids back into use. And it talks about the holidays, etc. But as it's a comparison between the same period in 2 years, there was a Christmas this year and there was a Christmas the year before. Are we on track to get more staff and get the void time down? Thank you, Chair.
Process of reorganising staff. The times that we've had in this council, in the history of this council, as I said last night, and there is a lot of work to be done, obviously keeping on top of everything. So it is what it is. When the new structures bed in properly, that will be when we will see an improvement.
No other members indicating, so I think that is it. In which case, I call the meeting to a close. It's 23 minutes past 7. Thank you very much for your attendance. Thank you.